Good morning, Dr. Stitt. Good morning, Ashley. Welcome to the Valder BB Show. How are you both today?
Doing great, well. Thank you.
Dr. Stitt, I'm going to start off with you. We need to know more about breast density because we think we're taking our mammograms and we're just thinking we're okay. But now there's a delineation between breast density and non-breast density. Am I correct in that?
There is. And, Valder, thank you so much. This is Breast Cancer Awareness Month. And so the timing is perfect that we're having this conversation. So yes, I think this is information that we as providers have always had, but the FDA's newest regulations are now, giving that information to our patients as well. So this is something we've always known. 50% of women have dense breasts, and it is perfectly normal. And your breast density changes throughout your lifetime. However, now what we've realized, what we already knew, but patients are also realizing is that this increases or decreases the ability to really identify those, those abnormalities on mammograms. Again, I want your listeners to know that when we talk about breast density, it's not what you see or feel, it's what we're talking about specifically on mammograms. On mammograms, breast density appears as a whitish appearance, but so does cancer. And many of the cancers actually will develop in this area of the breast, in the glandular parts of the breast that more women who have dense breasts have. So this is information we've always had, but now that patients have the ability to actually question their providers about it, it's allowing patients to be more empowered, which is wonderful.
Before I go to Ashley, I'd like to know, you guys are making these changes, and I see technology making these fast advances for medicine. But is the medical providers and supporters, such as insurance, are they on the same plane as you?
And that's an excellent question, and I think a lot of it is very regionally based. But this is where, these conversations and allowing patients to also be advocates for their care. And I always tell my patients, remember, I'm also a patient. I get mammograms as well. I think that having these conversations will, push insurers to cover these supplemental tests. But no, they are not widely covered, which is why it's so important to make sure that you're having these conversations with your providers. I often have patients come in and say, oh, I want an MRI or I want an ultrasound. I'm like, well, let's kind of, let's do a little bit of, take a step back and make sure that you are an appropriate candidate for getting these supplemental tests. And then we can advocate or push the insurance companies to make sure that they're covering it. But that's where it comes to having more of an individualized, more nuanced approach to taking care of each individual patient.
By itself, Dr. Stitt, I would love to spend time with you, ask you, when candidates who are running for the highest office in the land is not talking about this is what we care about. I don't care about somebody's hair. I really don't. I want to know what's going to happen with my mammograms. But thank you so much for that. Ashley, I'd like to know, based on your experience, tell us about what you learned about screening and prevention.
Learning about my breast density and my BRCA2 mutation changed my standard of care. Genetic testing helped me to understand my personal risk for breast and other cancers, especially given my family history. On my mother's side, there's multiple breast cancers. My mother had metastatic breast cancer, and my father is a prostate cancer survivor. The MYRIAD My Risk provided insight beyond what I could see, beyond what I could feel. The information was overwhelming at first, but this knowledge empowered me to be able to make informed decisions about my health, and it gave me a peace of mind by providing a roadmap to monitor and reduce my risk. And this was through early initiation to screening, which I began at the age of 21. It also increased my frequency of screening as well as my screening modalities. So in addition to breast mammograms, it was also breast MRIs and breast ultrasounds. Also being able to make lifestyle changes. And then finally, the decision to have a preventative double mastectomy at the age of 31 to drastically reduce my risk. Finally, this information has allowed me to have open, honest, and ongoing conversations with my family and my children about their potential risk, which can help them too to make informed decisions about their health with their doctors.
Thank you so much, Ashley, for sharing your personal story. You've probably changed many people's lives by telling this story, so thank you for that. I'm going to go to Dr. Stitt. Dr. Stitt, let me ask you, the annual screenings and breast checks, why is this so important, and what happens when you need to go further? You kind of touched upon that, but what happens when you need to go further after the annual screening?
Yeah, I tell my patients all the time that, it takes more than just one imaging, one breast exam for me to be able to make a clinical, help them make a better clinical decision for themselves. The importance of these annual screenings, it gives us more information. It provides, more insight into what's going on with each individualized patient. And it helps us to determine whether a patient might be at need for supplemental screening, like these modalities that Ashley mentioned, MRIs, ultrasounds. A big piece of it is one of the things that Ashley mentioned was the family history. That is absolutely vital. It allows us to determine those women that are at the highest risk based on their family histories. The test that I use, that I believe in, is the MyRisk hereditary cancer test with risk score. This is the first and only genetic test that has been clinically validated to assess a breast cancer risk in women of all ethnicities. The vast majority of genetic testing that's been done over the time that we've been doing genetic testing has been done on women who have European ancestry. This is the first time and the only test that will allow women of African, of Latina, of Asian, of Native heritage to be able to get a fair and equitable assessment of their breast cancer risk. And this allows for individualized and tailored care as opposed to kind of a broad pink stroke for all women.
Finally, I'd like to ask you, Dr. Stitt, what happens if for some reason, usually financial, you skip your annual mammogram? What are your thoughts on that?
I think that, occasionally that happens. I really would prefer that my patients get annual mammograms, but life happens and situations happen. Just catch up as soon as you possibly can. But in the meantime, in between time, if for whatever reason you can't do it, make sure you're doing your self-breast exams. We really don't need them to be, every month anymore, but just being aware of, I teach my patients every single time I see them for their annual exam, it's more than just checking the breast, but checking your lymph nodes and just, again, knowing your family history. If you suspect that you might be at higher risk based on a family history, then really try your absolute best. There are programs, for example, Planned Parenthood does free mammographic screenings. So there are definitely, and there are mobile mammogram options that, for people who may not be able to get them due to financial constraints. But there are resources out there, and I just implore every woman to make sure that you're aware of those resources.
Dr. Stitt, thank you so very much for your expert information. And I'm going to wrap up with Ashley. Ashley, you are the expert here among us, those people listening, those people who are having this interview. What would you like to leave my audience with, and where can they get more information?
Absolutely. I think it's so important to know your family health history, but there's also persons who might not have a family health history. And so it's important to still have that personalized conversation with your doctor. It's important to know that family history can change and the information can be overwhelming. It can be new, but it's really important to have ongoing conversations with your doctors. I really say that this is the information, the gift that keeps on giving, because with this information, I'm able to help change the generations to come from my family. Breast cancer impacted 3 generations of women in my family, but my girls and I can proactively and preemptively get ahead of this disease.
And online, can they find? Go ahead.
I was going to say, I'm going to kick it back to Dr. Stitt to share where they can find more information.
Sounds good.
Yes, getmyrisk.com. And I couldn't have said it better, Ashley. That was absolutely perfect. But getmyrisk.com allows for you to get that individualized, information. And again, please partner with your healthcare provider to make sure that you are getting the care that you deserve.
Dr. Stitt and Ashley, this has been a wonderful time spent on the Valder Beebe Show. I thank you for helping me make my show better. Have a great day.
Thank you. Have a great day.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBB Show and stay connected as I interview the world's most fascinating people.